This short video is on the subject of TMJ Pain. It is brought to you by the Atlanta TMD Institute. We're located in Atlanta, Georgia. Our purpose is to educate dental and medical professionals in TMD, to develop knowledge of temporomandibular disorders, which we're doing with you right now, and to successfully treat patients suffering with TMD. We are a secondary and tertiary treatment facility where we take direct referrals from physicians and dentists or patients that have been treated previously unsuccessfully and sent to our institute to be cared for. We're good at it. Let's get a handle on this term TMJ. IRS, Internal Revenue Service, is an acronym. It's a few letters meaning something else, standing for a longer phrase. And the acronym TMJ stands for temporomandibular joint. Every human being has two temporomandibular joints. Many are normal. So we can't say you have TMJ because most normal people have two TMJs. TMJ is a bad term. And TMJ stands for the actual joint in front of the ear. If you look at the side of the skull, looking on the left side, circle temporomandibular joint, it's the joint that connects the lower jaw, the mandible, to the temporal bone of the skull. So when you're talking about TMJ pain is only pain in the temporomandibular joint, the jaw joint. So if you take your four fingers and press them on the joint, open and close it, hurts like hell, that's TMJ pain, because that's pain in the temporomandibular joint, the jaw joint. This can get very confusing because the real term that should be used for when most people are talking about TMJ is TMD, not TMJ. This is because temporomandibular disorders have lots and lots of signs and symptoms in addition to just the jaw joint pain. This is not only a jaw joint TMJ problem, right? It's a whole head and neck problem, and including other parts of the body. It can get very, very complicated. Seriously, I have a whole book of, I don't know, about 150 to 200 pages simply on the etiologies or causes of the signs and symptoms of TMD. It's extensive, and it crosses over different specialties: medicine, dentistry, chiropractic, physical therapy, ear, nose, and throat, neurology, ophthalmology, just bunches of specialties that are involved in this one disorder, which makes it extremely confusing. This is a list of some of the signs and symptoms taken from a handbook that we issue to students of TMD, the basic course, but we're just going over signs and symptoms. In the joint itself, you can have TMJ pain, TMJ clicking, TMJ popping, and TMJ crepitus with the scraping noises. That's bad. You can have pain in the face, right? You can have cheek pain, forehead pain, right? There's all kind of pain in the lower part of the jaw. So the face itself can have pain. You can have pain behind the eyes, pain in the eyes. You have light sensitivity. Ear pain, get that. That's really something. Ear pain is extremely common. Most people don't know that 50%, half of all ear pain is not from the ear. Isn't that nuts? So you go to the ear doctor, ear, nose, and throat doctor because you're having ear pain, and half of the time he doesn't know what it is because it is not, it's not from the ear. And then we have sleep problems like morning headache. When you wake up, that's a sleep disorder. Could be obstructive sleep disorder. There's some other things it could be, but irregardless, pain can be all over the place. Crazy. Headache pain, temporal pain, that's what's the temples, forehead pain, occipital pain, pain in the back of the neck, right? Migraine type pain. It's not migraine, guys. You've been told you have it, but you don't. But I'm not saying that's all the time, but I'm going to say crazy most of the time. So most of the time when people say they have a migraine headache, guess what? They don't. they've got a musculoskeletal headache, and it's related to TMD, for real. And then you've got other things, dental problems, hot and cold sensitivity, tooth pain. You can actually have teeth removed. We had one patient come in 2 weeks ago that had a tooth just recently removed by an oral surgeon because of tooth pain. And when the tooth was removed, guess what? Pain was still there. Craziness. So the word cervical means neck, and you can have like a stiff neck, but you can have shoulder pain, and you can have back pain from TMD. You can have throat pain or sore throat from TMD, and then this other stuff related perhaps to the TMD, such as trigeminal neuralgia, and I said migraine headache, and Bell's palsy. These are crazy things. We're not saying they're all like trigeminal neuralgia could be related to TMD. It's the same exact nerve, the trigeminal nerve. But there's lots of craziness in this whole thing. There's just lots of things going on, lots of pain everywhere. So these signs and symptoms come from a course that we teach, TMD, the Basics Handbook. And it comes directly from the handbook because we try to teach dentists how to treat TMD. And it's difficult because only last year, 2020, did orofacial pain become a specialty, and TMD is like a subset. So it's not taught in dental schools very much, and as a result of that, it's confusing. And then there's also competing philosophies. There are actually some groups of people that believe it's a psychological problem, and I'm like totally on the opposite side of that viewpoint. But irregardless, these are the signs and symptoms, and pain in lots of different places can be associated with TMD. Obviously, you're looking at this video, so you know we have a Atlanta TMD Institute website and Atlanta TMD Institute YouTube channel. Yay! And this is one term we're working at, but if you want to spend a little time in our patient education video section, look at the signs and symptoms of TMD, TMJ. Look at it, because that is going to give you some ideas. It's a 33-minute thing. It's meant for patients. So if you're a patient, you want to learn a bit more, go to that, click on that, look through it, okay? If you're totally crazy and you're a regular patient, or if you're a doctor, you can go into our doctor video sections, and I've given, get this, I've given 4 lectures simply on the signs and symptoms of TMD. Right? It adds up to about 3 hours of information just on the signs and symptoms of TMD, which are like all over the place. And you can look through this, and I would highly suggest to stop the video, open a book and look up a term, look up each one of the muscles, learn the muscles, what they do. Take your time. Go through this. If this is a disorder that you have and you really want to learn everything about it, you need to break it apart and look at it and figure out your particular case. And then that way, when you go to doctors, you can explain to them what's going on, where things are going. Also get the appropriate treatment, because this is you. It's your body. So thank you so much for listening. I hope the video has been helpful. We're going to be issuing, we're going to try to get one every week, but it's different things. It's TMD assistant education, which is important, doctor education, and patient education. Our purpose is to educate, develop knowledge, and create a healing environment for everyone, and to empower dentists and physicians so that they can help their patients, and to empower patients so that they can get the correct treatment and get better, healthy, and have a wonderful life. Seems like I always forget to give contact information, but the website for the Atlanta TMD Institute is www.atlantatmdinstitute.com. gives you the upcoming courses, patient registration, information about me on the first page at the bottom. You can click on it. The telephone number is 404-876-8123. Email, my personal is drpodolsky@atlantatmdinstitute.com. So take care. I hope this has been helpful, giving you something to hold on to and perhaps get some hope from. I do want to say particularly that TMD is a orthopedic problem. It's like a broken leg. And so many people think that they can cure it with a pill, or they can cure it with one type of appliance, or they can go to anywhere and get the same kind of care. It can't be done. It is your jaw position, in my opinion, strongly 40 years of experience. If you don't correct the jaw position, the head position can't be fixed. If the head position is not fixed, the muscles will always be in pain. You'll get Botox, but the pain is coming from the muscles trying to correct things. You take the Botox and now your joints start deteriorating because the muscles were protecting bad joints. Or then your neck can't heal because you're posturing forward in order to avoid the pain in the jaw joints, or posturing forward to breathe better through your mouth. And then your tongue, because your jaw is slipped backwards, your tongue is slipped backwards. So it's an orthopedic problem. You really need a knowledgeable dentist. It's not a simple thing. It's not just one thing. Patients that come into our institute have 10 or 15 common problems. I'm going to say that again. They have 10 to 15 common problems associated with TMD. All of those problems have to be taken care of to regain health and well-being. So there you go. I've given you the contact information. Please feel free to look at all our videos, perhaps like us and subscribe. That would be wonderful. And if you have questions, you can also, on the bottom of the videos, put in questions, things that you're interested in learning more about, and we'll consider making a video.